Hi friends, it's Veronica Wax, naturopathic physician, happily retired. Today we are going to continue our education on the topic of digestive tract. The topic is fatty liver, symptoms, diagnosis, and treatment. It probably will be 2 videos, and we will talk about causes. We will talk about possible symptoms, diagnostic tools such as laboratory work and ultrasound, although it's not a gold standard diagnostic tool. And then we will talk about the treatment and possible supplements. According to Mayo Clinic website, the fatty liver symptoms in patients will be presented as fatigue, discomfort with right upper quadrant pain, ascites, spider angioma. This one is a picture of spider angioma, enlarged spleen, red palms, jaundice means yellow, yellowish skin. In my personal experience, very few patients will be presented with the symptoms, because this is symptoms when the disease is already quite advanced. Most of the people will be presented with digestive complaints such as acid reflux, gastritis, bloating, gas, indigestion. As a result of indigestion is malabsorption, because liver is responsible for breaking down the fat, so it will be malabsorption of fat substances. And it will be seen as on deficiency of vitamins, fat-soluble vitamins such as A, K, E, and D. So, and also quite often the first symptoms of fatty liver is so-called metabolic syndrome, also called syndrome X, or insulin resistance syndrome, or dysmetabolic syndrome, which could be presented as, in some patients, we don't know why, some patients will have elevated blood pressure, the other will have elevated blood sugar, but almost all patients in metabolic syndrome will have beer belly. They will have abnormal elevated cholesterol and triglycerides level, and then they will have all kinds of digestive complaint or not, as I will show in this example. So what we are going to do, I will tell you about clinical case that I had in my practice several years ago. The patient and the picture of the patient, very similar here, that patient I had. It was just a little bit older guy, not that thin and slim, but in general, looking at the patient, I would never say the patient has an obesity. It's important to remember about that. So about 40 years old, white male, with chief complaint of low sexual desire. He also did laboratory work from his primary care physician. On the laboratory work, it was discovered that he has a low testosterone level, slightly elevated cholesterol. The rest of the laboratory work was within normal limits, meaning that CBC with differential was normal, liver function test, kidney function test, everything was normal. So what PCPs did, he recommend him to go to specialist for testosterone, because patient was living in the area where I had my practice, and many people were my patients there. He knew few, and he heard from them that I am very much against all kinds of hormones. So he decided to come to me and talk about what can do at first diet-wise, and maybe take supplements to increase level of testosterone. I talked to patient about his diet. I had some recommendations, and then we talked in great details about foods that he can eat to increase level of testosterone, and couple supplements I recommended, including yohimbe. So patient agreed to make some changes in his life. And also at the end, I said, well, it would be a good idea to check level of your estrogen just for the sake of science, and give him laboratory work again. So 4 days later, laboratory work in my office, and right behind patient on laboratory work, elevated estrogen. He realized that he has a problem. I realized we have a problem. Male do not supposed to have elevated estrogen. So let's talk about testosterone and estrogen in male. So testosterone in male come from 2 sources, testicles and adrenal gland. From testicles, testosterone get converted into more potent form of testosterone. When it's produced by adrenal gland, it gets released into the bloodstream. So here on the right, You are looking at the picture, how testosterone is made in adrenal gland. It's made out of cholesterol. So cholesterol in adrenal gland then converted into a few types of enzyme hormones. Excuse me. One is called mineralocorticoids. Then the other branch is corticosteroids, and cortisol, anti-inflammatory hormone, is made. And the third branch, again, out of cholesterol, it gets converted to precursors of testosterone and eventually to testosterone. This testosterone is released into the bloodstream. And in peripheral tissues, it gets converted to estrogens. Peripheral tissues are brain and fat. So when patient in my office, what I have to do, I look for a couple items. So I have to look if he have extra fat, and they ask him a question, where it's coming from. So what's the diet of this patient is look like? So, and that's what I did. But you have to understand also that in males, the elevated estrogen should not be dismissed. As I told my students when I teach at the naturopathic medical school, never treat the laboratory work, but never disregard it. So high estrogen level have to be addressed. So what you are looking is, I have to look for estrogenic symptoms in this male. So I do physical exam. Estrogenic symptoms is in males are usually expressed as gynecomastia, meaning as lay people will call it, man boobs. So I do a physical exam on the patient. Yes, I see enlarged belly. Overall, patient does not have extra fat tissues, but the belly is enlarged. He has a little bit bigger belly. And yes, he has just a touch of gynecomastia. So keep in mind, because I see that, I have to do a differential diagnosis. This enlarged breast tissues could be due to different reasons, such as pituitary tumor, which comes with milky discharge from the breast, checked, none. Could be genetically, some males will have 2 X chromosomes, usually they're infertile. And I asked this patient, he has a child, is it your child? And he gave me 100% yes. Drugs sometimes, testicular tumor, I tested, I looked at that, there is nothing there in the testicles particular, and some chronic liver diseases. So I checked the liver on physical exam, and also keep in mind that on laboratory work, liver function test also was absolutely normal. So I told my patient, this is your diet is a big problem. Okay, so let's talk about the diet. Turns out that he has very creative, high stress job in New York. Absolutely loves that. On the way to New York, because I had my practice in Connecticut, he takes a train, has a coffee and croissant. Croissant is a sugar. At work, they usually eat either Chinese takeout or pizza or some kind of sandwiches. So all of that is high sugar diet. Before he comes home for a healthy meal, which is I classify as a healthy because his wife was cooking, he goes into the bar and meets his friends and colleagues. It's important for him because that place not only they are all socializing, but they are discussing ideas, and exchange of ideas take place. So in the bar, he usually have 1 or 2 beers or 1 or 2 hard drinks. So it is again, alcohol plus high sugar content. So I told the patient, your sugar is a problem. Why? When people have an elevated sugar, some people convert that sugar into fat. That's why I see beer belly. But in many patients that don't have a predisposition to be obese, because there is no, in the places where the fat's supposed to be, here on the belly or on the hips, they don't have genetic predisposition, so that sugar get converted to fat, and fat lays along the organs and within the organs. And this is not just fat, it is endocrine active. So meaning that in this fat, there is enzyme called aromatase that's convert exactly testosterone into estrogen. So we started to we talk about with him in great details of his high sugar diet, and he promised me to change. So as he lived in the office, I said that I check for everything. Although I'm not an endocrinologist, it would be a good idea to have appointment with endocrinologist and just to make sure that I don't miss anything. So he did schedule an appointment with endocrinologist, result of which was the following. So he was again confirmed low level of testosterone, high level of estrogen, elevated cholesterol, and it was found that he has a low level of enzymes. Here on this picture, what you are looking is, again, more complicated picture of the adrenal gland. Again, cholesterol is elevated here, and out of cholesterol made mineralocorticoids. Some of cholesterol goes and corticosteroids are made, and this pass were precursors of testosterone, and then this enzyme in his particular case is deficient. So he's not converted precursors of testosterone into testosterone, and he has elevated estrogen. So the net result of visit to endocrinologist was that go to Wax, go to me, and I have a supplement, because in modern medicine, there is no treatment for deficiency of this enzyme. So she has some supplements that actually will increase that. And yes, I do have. So, and patients asking me, which one? I'm very reluctant. I actually don't want to give them at all to patients, because look at that. What we have high cholesterol, we have low testosterone, and we have high estrogen. If I will give him a supplement and supply the precursors of testosterone and this enzyme, what will happen? He will convert them into testosterone, and immediately in the fat tissues, it will be converted to estrogen. And in male estrogen, that's exactly what I don't want. So I don't want to deal with that. So we talk again about high sugar diet, how sugar get converted in people in fat. Fat, it has aromatase. Aromatase converts in testosterone into estrogen, and that's what you need to address your high sugar diet. So when he was leaving the office, I said, hey, listen, we explore all of that. Liver function is normal on your LFT, normal on your laboratory work. So he promised that I will change the diet. But I said, would be interesting, just for the sake of science, to see how's your liver doing. Okay, because when the fat deposited in the organs, it's kind of deposits along the organs and within the cells. So patient does not leave any stone unturned. A couple of days later, I get patient end result of ultrasound. Here they are. Attenuation of the image, diffuse echogenicity, uniform heterogeneous liver, 6 subcutaneous depths. So what's that mean? Heterogeneity means, it's opposite term from homogeneity. Homogeneous means equal, all the same. There is nothing there. Everything is so homogeneous, right? So same consistency in this case means. However, diffuse echogenicity means, in chemical terms, it means that the fat is distributed evenly in every single cell. So the whole picture is kind of looks very good and consistent, but every cell is filled with something. So it's different. The wave penetrates differently. So there is some inconsistency in every single cell, meaning that the fat is within every single cell, equally distributed through whole the liver, which by definition is the earlier of stage of fatty liver. So here we are back again to the diet, to his high sugar diet. Now, you guys may be thinking, why is that I will give you this, giving this example? The one reason is I want you to understand the diet contributes greatly to your health. The second is the Mayo Clinic symptoms that patients supposed to be presented, none of them was there whatsoever. And even more, the digestive complaints were not there. At the earliest stage of the liver, fatty liver, you have to look at the patient's diet and you have to think, is there going on something? In this particular case, it was discovered, just accidental discovery. Okay, so next video is going to be on the topic of diet, Talk to you soon, guys. Thank you very much. Like, subscribe. Bye-bye.